This episode is brought to you by Clearsense. Their highly scalable, cloud-based Clearsense data enablement platform unifies healthcare data, making it more valuable, accessible, and secure for improved outcomes. Revitalize your health system's data to improve care, accelerate research, drive innovation, and generate substantial application decommissioning cost savings. Visit thisweekhealth.com/Clearsense today and learn how Clearsense can transform your organization.
Welcome to This Week Health. I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our interviews in action are a series of interviews catching up with healthcare leaders throughout the industry. Now, on to our interview. Welcome to This Week Health. I'm Sarah Richardson, and today I'm joined by Glenn Wirick, Chief Commercial Officer at Clearsense. Glenn brings a wealth of experience in healthcare technology and go-to-market strategy, with a strong focus on helping organizations unlock the full value of their data. At Clearsense, a company known for turning healthcare data into actionable insights, through its comprehensive data management and analytics platform, Glenn leads efforts to empower health systems to drive clinical, operational, and financial transformation. From legacy data migration to real-time data analytics, Clearsense is reshaping how healthcare organizations harness information, and Glenn is at the center of that innovation. Welcome to the show, Glenn.
Great to be here. I really appreciate having this chance, Sarah.
I usually chat to Jason, and so I'm stoked to be able to continue the conversation with the rest of the executive team at Clearsense. And I have to start by asking you to tell us about the big picture. And so for those that are less familiar, can you share how Clearsense came to be and how its mission has evolved in today's environment, especially where data saturation is a little bit of everybody's problem right now?
Yeah, I love that question. So the origins of Clearsense, we started as what we call a data enablement platform. So that's really core to our mission. We're here to help enable the use of data, elevate the value, accelerate the value. That's what we're on track to do, and we're focused exclusively, of course, in healthcare, primarily with health systems. How that then shows up over time is that we see that health systems typically have over-bloated portfolios of applications. Health systems, I will say kind of tongue-in-cheek, I heard a CIO say this, that health systems are really good at buying and acquiring applications, probably less good at decommissioning when they're no longer necessary, right? Gartner has a stat that all health systems out there range between 20 to 30% in over-bloated applications. And so as we evolved, we became very focused on helping solve that problem. Because for health systems, not only does that increase the cyber risk, because you now have a bunch of applications, some of which might not be in maintenance anymore, there's also millions and millions of dollars being spent that don't need to be spent. And so we're very focused on helping health systems be more profitable, cut their costs. But the final piece of it, Sarah, is that data living in disparate systems also tends to not be that useful. So we've got some very interesting methods of pulling that together so that you have unified views of that data. And I'd love to talk about at some point the value from data that you can get once you pull that together the right way.
Well, let's be honest. I mean, there's a data platform everywhere. There's all kinds of different ways that you can solve for the problems, but your approach is different. And your analytics are completely different in terms of how you approach that perspective as well. I'm curious what you're seeing and where you're seeing the most traction with health systems right now, in addition to the whole app rat space, which is such a fascinating term that we've introduced out there. I still go for the rationalization aspect. So it sounds a little more appealing. But what are you seeing from your clients right now?
Yeah, well, one, let's see. Let's start with app rat. All right. So the app rationalization is the exercise of going through and understanding the portfolio of applications that you have, when they might be end of life, the contracts associated with them, and very importantly, are they duplicative to other applications, and are they redundant? Are they usable anymore? A lot of health systems we run into have done some level of that analysis, some more robust, some less. But there tend to be challenges from that point forward on executing, even though we've done the app rat, let's just say. And let's say that analysis shows us that we could reduce our spend by $20 million if we decommission and therefore archive data the right way. we're seeing that health systems often struggle with the execution of that. And a lot of times it has to do with bandwidth, and it also has to do with capability, because it doesn't tend to be anybody's full-time job to deal with that problem. And people have their hair on fire as they're looking at rollouts of new EHRs or new ERP systems. And the app rat and decommissioning and archiving tend to be the kind of ugly stepchild that's continually put off to the side, even though we know it's important. And then what we're also seeing, what really magnifies this, is any health system that is active in mergers and acquisitions. Because obviously, as you're pulling stuff in, you're getting that many more apps that are potentially duplicative.
I feel like this is a strength for you as the legacy data management component and the archival of that information, because this is a critical piece of what we like to call, I guess, digital transformation. But I'm curious how you're helping organizations move from hoarding data to using it truly as a utility. And I'll just throw in identifying that source of truth when you have duplicative information coming in from overlapping application capabilities.
Yeah, that's great. And what I'll do is I'll kind of compare to the modern ways that Clearsense treats this to kind of what were some more historical ways that archiving was treated the further you go back in time. First of all, archiving historically was treated as, well, I've got data retention rules, compliance and legal rules, so I need to keep this data. So I'm going to decommission some systems and I'm going to basically put it on a thumb drive in the cloud or in my server room. And now I'm meeting my compliance needs, but my data is sitting there unused. That's challenge one. You're not going to get value from the data, obviously, when you do that. Secondarily, we have also seen a lot of instances where we come in later in the game where archiving has been done kind of tactically. And so you'll have a one-off project like, oh, we're changing our EHR, so we're going to decommission these 7 apps. And we pay somebody to go do that. It's more of a services, one-time engagement, and the data gets set in some kind of a data store, where there might be some kind of query access, etc. But then some months later, another tactical project will come. We're going to do another data store, and I put 9 apps in this. And what happens with that data, to the point I think you were alluding to, Sarah, is the data still remains disparate. And so one of the unique things that we are very focused on, all of our solutions do this. We take all of the data, we combine it to what's known as EMPI, that's an Employee Master Patient Index, so that there is a single longitudinal record for each patient, no matter how many different systems the data originated from. In the way that we combine that, now Bob Smith, the patient, whether a provider is looking in the EHR and pulling that legacy data in combination with the live data, they can see Bob Smith as a single patient, even if his data previously lived in 9 systems, right? Then you take that to the next level. Now that we've got this holistic view of all of the data in a single place, now I can do really robust analytics that weren't possible before. At least not possible without months-long IT projects to try and normalize that data, dedupe it, etc. And that gives you access to future innovations, AI modeling, etc. So I'll kind of tease that out. Maybe we talk about that a little more. But this unique approach to data really enables a whole bunch of future possibilities.
Well, and it's got to have that clinical impact as well. And you mentioned like having a single source of truth as an example for better delivery and decision making at the point of care. What are some of the things you've actually seen or worked with clients that have been like, hey, now this nurse can do this, or this doctor or this research team is able to create these capabilities within the organization?
Well, one of the feedbacks that we get, it's pretty basic, but it really impacts the provider's ability to be effective, as well as the patient outcome and experience. And it is very simply every morning, the member of the staff that's responsible to do so is able to look at the provider's schedule and go easily into the Clearsense interface or in through the EHR, either way, and pull the longitudinal record for each of those patients. Now, sometimes that patient's longitudinal record, it's represented in current live EHR data, and that's enough. But especially for patients that have chronic ongoing conditions, it is really meaningful and powerful to have that entire health history provided to the doc in advance before they go into that one-on-one with their patient. Likewise, the provider themselves can open the EHR during the patient discussion and also pull that history. And so without having that longitudinal history, it's a game changer, like I said, for the kinds of patients that have more of those long-term chronic issues.
The fascinating part about all of that is getting there. And I've been in organizations where setting up the environment for the points you just made is one of the hardest elements. It's all about that data governance and ability to create trust within the organization and what value propositions are being presented because of it. How do you help health systems build governance frameworks that are sustainable and scalable? And the piece I'll sort of feed out there as well is my previous organization was all about setting up the environment and then thought it would just self-sustain and didn't want to fund it anymore. And so the fight to keep it alive after we created it, how do you help organizations do all of the components it actually takes to get to a governance model with data that works?
So I love the question. It kind of hits on two things we talked about already. One, you asked about the evolution of our company. Part of that evolution was really getting our arms around to exactly what you're talking about. Because on the one hand, we provide the technology and the methodologies to get that data put into this very valuable state, highly usable, single longitudinal records, etc. However, to your point, upstream of getting it into our technology, there is all of the stuff that is the governance and how do I get it from a spreadsheet list to actually putting it into a solution like ours. And I said that a lot of times entities will do some form of application rationalization. But even if they've done a really robust job of that, it often gets left, there's this gap. Very often, if somebody's going to do robust AppRat, they're hiring a consulting firm. The consulting firm comes in, they do robust AppRat. Here's your list, here's your priorities, here's the cost takeout available to you, generally in the many tens of millions. But then that consulting engagement is generally done. So now, to your point, the health system is left to manage that. So part of Clearsense's evolution, we've developed something we call acceleration services. We did this with one of our largest and most successful clients who really has helped set a blueprint in the industry of how this should look. And they've been very partnering with us such that we have that soup recipe. And so these acceleration services are brought to the health system to help them manage the governance, the execution. If the AppRat hasn't been done, we can also step in and facilitate an AppRat exercise such that we build this pipeline of applications that feed the machine on an ongoing basis. And these two things together really accelerate how rapidly you can get the data into the store such that you're getting the value from the data, but also so you can decommission many more apps much more quickly, such that you get your cost savings much more quickly. And not only are we able to bring some of these services to bear, we've partnered with some of the best of breed entities in the space. I'll give a little shout out to your viewers, Sarah, that there's about to be a press release that hasn't dropped yet about a strategic partnership with Nordic. Nordic is excellent at the acceleration services part of what we're talking about. We're already engaged with Nordic on a couple of really interesting opportunities where we're dramatically accelerating large health systems' ability to do everything that we just talked about in a much quicker time frame.
So your preference is that the rationalization is actually in concert with the services you bring forward because they can be done at the same time.
Absolutely. So again, if a health system is paid for an AppRat exercise and it's robust and relatively current, we can step in with our acceleration services right off the back of that and continue forward. Because to your point, Sarah, that's usually the hard part for the health system. It's after AppRat is done and then getting it to actual fruition. That's the hard part. So we step in and facilitate that, or one of our partners like Nordic facilitates that. But the point is, if a health system, either their AppRat's out of date or they haven't really even done AppRat, we absolutely, ourselves or Nordic, can step in and do that kind of an exercise while we're then building the governance processes, et cetera, so that we're really ready for prime time, can move really quickly.
It's still truly, though, one of the most exciting spaces when you are in health systems or organizations to be able to like maximize and optimize the applications and pull the information and present it in a way that is usable for people and save money doing it and make money with the insights that you're gathering from it. That behind the scenes architecture and planning and like sausage making are the pieces that I miss from being on the front lines occasionally. But there is a ton of buzz around AI. And I'm curious how Clearsense incorporates AI or machine learning into your platforms. How do you help clients separate what is hype from what is practical application and not letting noise drive the right use cases?
Right. Yeah, I love that question because AI is a buzzword. Everybody's talking about AI. AI is not always successful. And so here's how we think about it. And Sarah, I'll be really upfront and state that when people talk and hear about archiving in isolation, that's probably a much more boring kind of a topic. It doesn't sound as exciting and it doesn't sound as interesting. But when you treat archiving strategically, you can really fund and drive other innovation. And so that's one of the most exciting aspects that we talk about with our clients as we accelerate that cost takeout. Number one, we have health systems, we're taking tens of millions of dollars out of OPEX each year. Imagine freeing up 20 million in OPEX every year, what you can do with innovation. So that's why I say it can fund innovation, literally taking those funds that were previously being more or less wasted on duplicative apps, now funding. But why I say driving is because once you have the data in this state, you've checked the boxes for compliance and legal, you've solved the more boring archiving challenges, that data now lends itself, and we've got some significant customers doing this. I'm allowed to actually drop this particular name, which is UPMC, where they are doing this. And they are using that rich data store that covers more than 6 million patients to drive AI modeling. So when they're looking at bringing a new AI solution in, instead of running it over prototype data, because a little secret about AI, it runs really good on the test data that the AI engine was built over. But when you put it against real world data, that's when you find out if the AI is really delivering what it's intended to deliver. And so when you can run it over this very rich data set, now you can truly validate the AI and tweak it as necessary before rolling it out. You then can use that data set for large language models and learning. And so you can also build out those kinds of models with the data. So those are just two of the really exciting use cases that our customers are working with us on. They solve the archiving problem, they get this massive cost takeout, and now we get to focus on the more exciting stuff.
And you also get to create that almost laboratory environment then when saying, I want this chunk of data to be its own LLM or this own perspective. So you can either de-identify it or use just different aspects of removing bias and looking to see what types of prompts and what types of activities work. And that's where so much confusion and sometimes concern comes in is what happens to my data? When you have a solution like yours, you are always in control of what gets fed into the systems that are going to create the outcomes or the insights that are necessary.
Exactly. And we're just scratching the surface on those two examples. Another big example for academic medical research type of institutions, that data can be used for cohort analysis. So you were talking about it, analytics, and we can use some very advanced predictive analytics to then identify cohorts that match certain research. And what that does for health systems is actually accelerate the top line. We've been talking about removing costs, but that accelerates revenue and grant funding. And we have a case study where previous to the Clearsense solution, the customer was taking on average 9 to 18 months to respond to one research opportunity. And that's because of all the deduplication of data. It's like a 1-800 call to IT, pull data from these 17 sources, match it together, dedupe it. Oops, now that I saw the data, I, the researcher, realize I have another question we have to go back through. That customer now can pull the data and know if they qualify for that cohort within 10 minutes to 30 minutes. So I frankly was in the meeting where that was stated and it sounded unbelievable. We dug into it, but that is the state. So this is really what's possible when you have the data in the kind of state that supports all of these exciting innovations that we're talking about.
Well, it's one thing to have a research institute or a university or different settings. What about smaller systems? What about rural? How are you seeing the C-suite appetite for what you can bring to the table in organizations that may not be as advanced in the funding or some of the capabilities? And even from the boardroom perspective, like how are you seeing a shift today in the ability for things like AI and data to be available more commonly in a way that is usable for those that aren't as well funded?
Yeah, that's a great question. And especially with some of what's going on with the uncertainty from recent Fed rulings, whether it's Medicaid cuts, which have obviously major impact for hospital systems, tariffs, et cetera, we're seeing this shift that more and more people, of course, are focused on how do we maintain profitability? How do we work on our margins? And frankly, Clearsense was born really focused on the mid to high end of the market, so the larger health systems. But over time, we've really evolved into working with some of the much smaller health systems. And you're right, some of the aspects of what they're doing with projects may not be as grandiose as what we were describing a moment ago, but cost takeout and getting value from data, empowering providers and driving better outcomes for patients, that never goes away, right? And so a thing that we've really doubled down on and we're getting very positive feedback for, we've updated pricing models over the last year to really ensure that the value that a health system gets is tied to what they spend with Clearsense. And so what that has done for us is our value prop and cost model makes a ton of sense for some of the smallest systems out there, as well as the largest ones, with spend being proportional to the value they're going to realize. But again, what we found is based especially on the current climate, those smaller health systems more than ever want to drive costs out and get value from their data.
Well, and there is economic uncertainty everywhere. And let's be honest, we've been in healthcare long enough to realize that it's a different source of that occurring. I mean, right now it's Medicaid and different models, but it's always been something that we're hyper aware of in healthcare.
It's a great hospital systems run on thin margins. That's just how it is.
3% average, which is kind of terrifying. But all of those factors being true and crystal balling, 12, 18 months. And I always laugh when someone says, oh, it's in our 3 to 5 year plan. I'm like, that's really hard to do now. And I sometimes think it's a waste of time if you're not doing that 6-month rolling plan. But let's just say 12 to 18 months. What's on your radar? Partnerships, product evolution, emerging needs. What are you seeing is spaces where you want CIOs and hospitals to lean in?
That's a great question. So number one, by the way, anecdotally, we just had that conversation with our board in a recent meeting that it makes the most sense to really plan 6, 9, 18 months out because things shift so rapidly in our space. So number one, we do believe there will be a further resurgence in M&A activity, an acceleration of that. It slowed down just a little bit, I think, due to the uncertainty, but 2024 was really strong in M&A, and we believe that's going to be an upturn. The more M&A occurs, the more you get duplicative apps, and the more you inherit multiple IT teams, the more you need to consolidate and get this kind of value that we're talking about from data and cost reduction. So that's something that we see continuing to escalate. And frankly, M&A is a major trigger point for people reaching out to Clearsense. I'll shamelessly drop that if you go to the Clearsense website, we've just recently released an M&A white paper, which is getting a lot of traction. So you might want to check that out. But a few other things. Innovation is going to continue to be very important, finding ways to be profitable, and then really leaning further into AI. All those things will continue and we think accelerate. And the final point I want to make on this is that Clearsense brings the ability for the client to bring their own tool. So when we talk about analytics and AI, you're not constrained into only using what Clearsense brings. Rather, we consider ourselves an enabling middleware where we can bring some of those capabilities, but you can bring them yourself as well.
I haven't heard middleware in about 5 years or more. So but maybe it's making a resurgence in the universe. I'm like, there's a throwback term for sure. Although this is more of an opinion question, and that's about M&A, because I worked in orgs that have done heavy M&A. And my 2 cents is always integrate as soon as you possibly can. Now, there's different reasons why you may or may not, but the longer you wait in that space, the harder it actually becomes, especially the change factor, the human change adoption component of the equation. What is your preference?
Yeah, well, what we've seen with some of our best of breed clients that are really good at getting the maximum out of their M&A, and it's something that we work closely with Nordic on, is making sure that the decommissioning and therefore the archiving of data is part of the M&A thesis. Because we align with exactly what you said, Sarah, the sooner the better. Sometimes we run into where you're going to have these extra apps, but it's like an afterthought way after the M&A. It's a lot harder to wrangle that in. And if you make it part of the M&A thesis, it tends to be driven top down. It happens more rapidly, more urgently, and then you're able to drive kind of a maximum cost savings from this kind of an effort to then move more into a focus on innovation.
Yep, I couldn't agree more. It's always a philosophical draw in those moments, yet the longer you wait, I always like the harder that it's going to be. All right, are you ready for speed round?
Yeah, let's go.
I love speed round questions. All right, here we go. Emerging tech trend in healthcare that excites you the most right now.
One of my favorite things is taking that data and making it highly usable and watching the use cases that come off of it, including, I'm going to use the buzzword AI. That's an exciting tangent, but really watching our customers get empowered by that holistic data is really exciting.
But don't you love that you've created an environment where they can go play with quick wins and it doesn't take, I mean, I had like almost like PTSD when you said, oh, that request that takes like half the team 9 months to scrub the data kind of a thing. So the fact that like those real time pet projects are pretty special right now.
Yep.
If you were able to change one thing in healthcare right now, solve it, what would it be?
I would love to see, this is biased by the space I specifically work in, but I would love to see application portfolio management become a more strategic initiative within all healthcare organizations because we continually see there's a lot of money and opportunity left on the table. And our clients that treat it more strategically end up with far more value from their applications and data.
Especially when you say, what is missing to get us what we need or where we want to go versus, oh, hey, this object just showed up. How do we try to fit it in?
Absolutely.
So, what's your favorite productivity hack or leadership habit?
I've got several things. First of all, this is going to, I mean, it sounds redundant and it's been said so many times, but transparency and constant communication makes everything run better. Jason Rose, our CEO, talks often. Everyone at the company is in customer support. And I love that that is our culture. It's one of the reasons we have such satisfied customers. But the hack is this: you can never communicate enough, no matter how much you think you're communicating. And so I run client success, and one of the things we're doing, as a number of our customers know, we're really doubling down on how we're communicating, making sure that our QBRs are even more strategic over time. So, yeah, communicate early and often. Every person in the company is in customer support and client success. Those are two of the biggest things that help our teams be successful.
I'm going to throw this one in there as well. I appreciate remote capabilities. I also do not believe that those deep relationships with your clients can be formed without seeing them in person. And so that everybody's in customer service, there's also the element of, and we actually go and see our clients and go to their hospitals and round with them and spend time with them and know what the heck is happening in their environments.
Yeah, that's a huge thing. We talk about it a lot. Couldn't agree more. I'm kind of old school, so I'm more of a face-to-face person than
Yeah.
a remote on a Zoom meeting person. But that's a thing that we do a lot. I was just at one of our customers last week where we're going out to see our customers on regular basis. And frankly, that's been a discussion that we've had too, where we're elevating that and making sure that we're getting to the customer as often as necessary face to face. Although you can handle things on Zoom, magical things happen when you're all in the same room together.
Well, because let's be honest, it's really hard to describe something you've never seen.
Yeah. Also,
So
probably because I'm old school. Whiteboards. Whiteboards are very
I
powerful.
love whiteboards. I know, and sticky notes and all the different elements. I think we're
Yeah.
about the same school of experience in the industry. However, if you weren't doing this, what would be the dream job? Money not
Well,
being the article. Like, it doesn't matter how much you make because pizza delivery could be a thing.
so I really, and I have done some of this, but I really love consulting because in a consultative role, you can bring these practices. And I love being able to work with folks on their hardest challenges and bringing solutions to bear. So whether I work for a solution provider, as I do right now, which gives me a lot of gratitude and pleasure, I really, if I wasn't doing this right now, I would probably just be working to be a consultant out there helping health systems improve in these areas.
Well, Clearsense is super lucky to have you on the team, and I'm so grateful that you and Jason have a history that allows you to keep amplifying everywhere that you go. All right, Glenn, as we wrap, what else should I know?
Yeah, well, one of the things that's right in front of us and we're really looking forward to is there are two 229 events happening in Napa. I think they are, one starts on June 19th and one starts on June 22nd. One of my colleagues will be at one of them, I will be at the other. And we love going to these. They're an awesome forum to really hear the needs and understand the challenges of these amazing health leaders. It's just an honor to be in the room. And then we get to share our anecdotes and case studies of what we see our clients doing to be successful. So can't wait to be up there. And it's not just because of the wine tasting.
Well, hey, it's the only summit that I get to drive to because that is literally my backyard. So I will see you there soon.
Fantastic.
Thanks for listening to this interview in action episode. If you found value in this, please share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we would appreciate it. Thanks for listening. That's all for now.